So I'm Claire Thompson, and I'm here with my colleague Lucy Cockle, on chronic disease, and one of particularly my special interest is diabetes. I'm a little bit obsessed by it, so that's why one of the reasons we've been asked to come and do this presentation. Lucy, do you want to just quickly introduce yourself?
Hi, I'm Lucy. So, as Claire says, I'm one of the primary care development nurses. I have a history of a neuro background myself, but been working in the team for about 3 years. So, chronic disease projects and things like that. I've just come along for a bit of a plane to keep Claire on track because she does go on a bit of a tangent. So, yeah, we'll hopefully you'll find the session useful.
To be honest, we were really delighted about being asked to come along and do a presentation around diabetes in women's health. Because to be honest, I think as a nurse, I worked as a practice nurse in diabetes for years, and we really just focused on treating the patients as they came in and not really stepping back and looking at the bigger picture about how diabetes affects women. So it's actually been a lovely presentation to work on, to actually focus on things. And I found it a little bit really sort of like interesting and sort of awakening really in myself. So thank you so much for actually making us do the presentation, because it's been a really good eye-opening thing for us really to think about. Basically, the aim of the session is to just cover the types of diabetes, what the impact of diabetes might be on women, and the risks of diabetes for women. I'm going to cover a bit on gestational diabetes that I'm a little bit obsessed about, risk factors for diabetes, and symptoms of diabetes, because that's really important. And also, we're going to talk a little bit about diabetes prevention. So before we start, I just want to run over what diabetes actually is. So diabetes is a condition that's caused by either not enough insulin being produced or your body not responding well to that insulin. Now, without insulin or a proper response to it in our body, our cells can't access energy. So insulin is often referred to as a key, and that key will allow the sugar from our bloodstream to go into our cells and allow our brain cells and our muscle cells to have the energy that they need. Now, if you have diabetes and insulin is not working properly, those cells won't be opened, and they won't allow that sugar inside, and they won't allow the cells to have the energy. High blood sugars, sugar trapped in your bloodstream is basically, that's how it allows us to diagnose diabetes, because then you can do a blood test and it'll show that sugars have been high in the bloodstream. And it bewilders me still, as a nurse who worked in diabetes for many years in primary care, how many types of diabetes and what a varied and amazing subject matter it is. I mean, when I was young, as a nurse, it was literally, we were taught there were type 1 and type 2 and gestational. You had a bit of sugar in pregnancy, and it's become on so much in recent years. So, you've got type 1, type 2, which we'll talk about a little bit more. You've got very genetic forms of diabetes, which is like maturity onset diabetes in the young, that tends to present before people are 25. Very genetic, very carried down one side of family. Again, different types can be treated differently. So getting that proper diagnosis is amazing, because then it means more appropriate treatment. There's things like LADA, which we used to call, so it's like latent autoimmune diabetes in the adult. And that is something that we used to call diabetes 1.5, because it sort of straddles the symptoms between type 1 and type 2. And again, a lot more understanding of that's developed. Steroid-induced diabetes, where patients can be develop diabetes because they put on steroids, and then when they come off the steroids, it resolves. You can get diabetes when you've had pancreatitis, that's 3C diabetes, so when the pancreatic damage. And then there's gestational diabetes, which we're going to talk more about, and that's why I put it in a different colour. So type 1 diabetes is the one that, to be honest, we tend to know more about, or we tend to be aware of. It happens because the cells are destroyed in the pancreas. The beta cells that produce the insulin are actually destroyed. and that results in the pancreas no longer producing insulin. And it generally occurs in teenagers or children. It can occur at any age. And I know the diabetic specialist nurses have told us about cases where people quite elderly have developed type 1 diabetes. So we can't ever say it's a condition of the young. It's just primarily a condition of the young. Because it develops, when they're young. So, but if a type 1 diabetic don't get insulin, they become very unwell, and they become very unwell very quickly. And actually, if they're left without insulin being administered, they will die. So any new type 1, it is so important they are diagnosed and treated rapidly, because if they're not, they can end up exceptionally unwell and admitted into hospital. And as a nurse, we see type 1s diagnosed really well, where they've picked up early, they're given insulin as an outpatient, they started on it, the care is amazing. And you can also see the ones where the diagnoses have been missed. They're admitted into hospital, they're very, very unwell. And they need to be supporting and nursing back to health before you can really get on to the nuts and bolts of learning how to treat somebody. So early diagnosis is so important, which is what Lucy and me are going to come and talk to you about later. So normally symptoms are very quick onset. There's rapid weight loss, thirst, passing shed loads of urine, and extreme fatigue. And we will go over them again because it is important that these symptoms people are aware of. But the symptoms present quickly. And really interestingly, because we were going it from a female perspective, there's no significant difference in the incidence of childhood type 1 diabetes by sex. But after the age of 15, you tend to get more males developing it. So that's quite an interesting little fact that, we were sort of point out, really. And then type 2 diabetes, again, slightly different in the fact that actually type 2 diabetes can be preventable. The body continues to produce some insulin, but not enough. And our body often becomes resistant to the insulin that's being produced. So in some type 2s, you can produce shed loads of insulin, but your body's not responding to it. Often it can be treated with lifestyle, such as weight loss. It can be put into remission if weight loss occurs and that weight loss is maintained. Very often oral medications are needed. And in some people, if they present and they're quite unwell, they may need to go on insulin initially at point of diagnosis. Often with type 2 diabetes, it's a progressive disease. So you can start off on tablets and end up needing insulin later down the line as well. So that's the difference, really. And really interestingly, young onset type 2 rapidly progresses. So it's a high risk phenotype, a high risk type of diabetes, and more women than men develop it at a younger age. And the increase, Lucy's going to put a little link in that's about some new evidence around type 2 diabetes, and it being very sort of the rates increasing in young women quicker than in the older women. And that's just quite an interesting fact, because we know that type 2 diabetes that develops early at a younger age is obviously going to cause more damage in the long term, more cardiovascular damage. So I think these things are really interesting, that you're getting this sort of uptick in women developing it at a younger age. So really interestingly, more men than women have diabetes. It's really interesting. So if you look at the statistics, it will say more men than women have diabetes. But there's always lies, damn lies, and statistics. And actually, yes, there are more men than women, but it's older men. So I like a bit of maths and I can't help myself. And Lucy will slap me for going on so much about this slide. But I don't know whether you can see. Can you see my cursor moving, Lucy? Is it actually moving on screen?
Yeah, it is.
Brilliant. So on screen here, you can see that the females are in blue and the males are in this like darker black colour. And can you see when people develop type 2 diabetes, look at the increase percentage that are women that are developing at a young age. Look at this under 25s. It's disproportionate in your female population. But the numbers, the overall numbers are small. Hence, when you look at a big picture of like the demographics of diabetes, you're missing out on this, because then later on in life, the men are overtaking the women in developing it, but they're developing it at an older age. So you're getting these high risk women that we're going to come to in the future that are developing it younger that could then go on to have more cardiovascular risk, more symptoms, long term, more complications, sorry, long term. So Lucy, did I well enough without that? I'm off the statistics
Yeah,
almost.
move on.
So the local data, actually, I went back and asked about the local data, and actually, they only break it down into the under 40s. So the local data in South Yorkshire still shows that higher risk in the female, but they only break down their data 40 and under. So it's quite interesting. So I was talking to Amy from the Young Type 2 Diabetes team about that. But unfortunately, these teams in the ICBs may not be here to look at these things much longer. So, but I think it will be something really, really important to nail down in the future to look at the demographic of the really young people developing diabetes type 2. So I'm stopping talking, Luce, over to you.
Yeah, over to me now. Obviously, risk factors for type 2 diabetes are quite well known. I'm not going to run through all of these. You can see them. Most people kind of know about them anyway, but there's just a couple that we want to kind of highlight. So obviously, increased risk having if you've got high blood pressure. So hypertension. So make sure that if you people have got high blood pressure, they're having their annual screenings and things like that, and just keeping an eye on things. Obviously blood vessel damage, etc. From that. History of diabetes in pregnancy. I know we do come on to gestational diabetes a little bit more, but if you've got someone that has had diabetes in pregnancy, they are at increased risk of developing type 2 generally. And I think it's something like 7 times the risk of actually developing the type 2 diabetes. Obviously, within pregnancy, once that person's given birth, that does subside. The diabetes does go away, but it's the lifetime risk for someone. History of pre-diabetes, we do come on to that shortly. So obviously, pre-diabetes, you're getting to the point where the pancreas isn't working properly or your body's resistant and you're just kind of borderline. You're not diabetic yet, it's prior. But one of the biggest things, so PMOS, obviously the new name for PCOS, so the polyendocrine metabolic ovarian syndrome, rather than just polycystic ovary syndrome. It recognises the whole metabolic process that the body is going through. There is also guidelines now within NICE, and I will add the link to it. Is actually if someone has got PMOS, PCOS, depending on which one you're using at the moment, they should really have an annual HbA1c blood test to test for diabetes, because it does increase risk. You get already the insulin resistance from the PCOS. I myself have had PCOS and I had a hysterectomy in September because of it. So obviously menopause as well, just hormonal fluctuations in the body is a significant risk factor for type 2 diabetes and insulin resistance. Also to note, obviously, your family history of diabetes and your strong down one side, as Claire explained earlier. But everything else still applies as well as on top of all them other items.
And then the other thing is just all the ones that are asterisked. So you've got blood pressure, you've got history of diabetes in pregnancy, you've got pre-diabetes and PMOS. They should have an annual HbA1c check. So that's a blood test for diabetes, and they are all eligible. So if you've got any of those conditions, you should be screened for diabetes every year, at least every year. Okay, so that's that one. So shall I go back to gestational, Luce? So,
Yeah.
so gestational diabetes, it's a condition that affects only women. So which is why we thought it were a very good thing to bring to this session. And it really does increase the chances of developing type 2. There's research that suggests it's between 7 and 10 times higher risk. And gestational diabetes is high blood sugar that develops during the pregnancy, and it normally disappears after the birth. It can happen at any stage of pregnancy, but it is more common at the latter stages of the pregnancy. And it's very different to a woman that's got diabetes that gets pregnant. It's a woman that's basically develops diabetes because of the additional stress of carrying a fetus. And basically, that woman, at the point that she has the baby, almost immediately her blood sugars will return to normal and she will cease to need medication. It is literally something that only women experience because only women carry children. So it is a very female specific topic. And to be honest, it's something I think that it's becoming more and more known about and more understood about screening, but it's not been well enough focused on in the past. And it should be something that we're all aware of, and we should spread the word about risk of type 2 diabetes in our friends, colleagues, families, and that they need screening after they've had a pregnancy, that they've had gestational diabetes. So the risk factors for gestational diabetes are if the woman is overweight with a BMI over 30, if they've got a big birth weight baby, and this is copied from NICE, so excuse the kilograms, you're looking at about a 10-pound baby. If they've had a baby that weighs more than that, if they've had previous gestational diabetes, so if they've had a previous pregnancy where they also developed gestational diabetes, if they've got a family history of diabetes, and obviously if there's an ethnicity prevalence as well, that would be another contributing factor to the risk of developing gestational diabetes. As we've said, NICE stated a seven times higher risk of type 2, but again, 7 to 10 seems to be the figures that are knocking around. We know that actually intervention can help reduce the risk of these women developing type 2 diabetes. And we're going to come on and talk about the NHS Diabetes Prevention Programme and how wonderful that can be for certain women at reducing the risk. The other thing is the relative risk of type 2 diabetes increases with each affected pregnancy. And it is higher risk for the women first 5 years after the episode of GDM. So they're more at risk of developing type 2 in that 5 years post GDM episode. However, the research shows that risk is lifelong, that increased risk is lifelong. So they need yearly testing every year. It doesn't matter whether they've not developed diabetes in 15 years since that episode of GDM, they need lifelong testing. And that's something that we do sometimes hear that people get wrong. They're told, oh, well, you haven't had it for years, so it don't matter about that blood test. You've not developed it. That's wrong. You need it every year. So I just thought it might be a nice idea to draw things together, just in case I've gone off on a tangent anywhere. So what does a woman need to know about diabetes? Well, the data suggests that young type 2 occurs more often in women than men. And in pregnancy, we know that we are higher risk. We know that only women get pregnant, and we know that women are therefore the ones that would develop gestational diabetes. And we know that gestational diabetes increases our chance of developing type 2. It can actually be a warning sign, really, for lifestyle change. And I've had women that have had GDM in one pregnancy and made brilliant lifestyle changes and haven't had it in the subsequent pregnancies. So again, you can treat things like, oh, well, I've had gestational diabetes, so that's it now, I'm going to get it in every pregnancy. Well, that is simply not true. It is like, if we can intervene, give support, give lifestyle support, it might mean that the subsequent pregnancies don't go on to mean that they have to develop gestational diabetes. As Lucy says, we have a condition with women of, I'm gonna say it wrong, Lucy. Go on, say it for me.
Polyendocrine metabolic ovarian syndrome.
It takes me about 10 years to catch up with changing words, so I'm really sorry. So what we used to call PCOS. So and that we do know that there's insulin resistance, and we do know that women have hormone fluctuations, and we know that the drop in estrogen increases insulin resistance. So we know, and we also know that if a woman well, I know this because I'm not going to stand up and show you my belly, but basically, if you're a woman that's gone through menopause, you're more likely to lay fat down centrally. So when we're younger, we tend to lay it down in other places, like on the hips and thighs, and then the hormonal changes predispose us to laying it round centrally, and that again increases your risk of type 2 diabetes. The other thing that I really don't think I really grasped were that actually women with diabetes have worse cardiovascular outcomes than men. So and that may be because it seems that men develop diabetes when they're not as overweight. So it almost feels like that might be the reasoning behind it, but they don't really understand why. And this is why me and Lucy go on about this. We're bores about it really. But in women's health, not enough's been done to understand how women's bodies are different to men. And diseases seem to be very much like, oh, it's a disease, as opposed to it's a disease in the way it presents in a woman. And I think that's probably something that as years go on, that will get built on and understood a little bit more. And really, really importantly, is just don't look at the headline statistics, because diabetes is not just a disease of the older man. It is far from it. So type 2 is developing at a younger age, and it's affecting disproportionately young women. And even so, type 2 diabetes is underdiagnosed in the general population. And now I'll stop talking.
So then, we've said a lot of information at that point. Let's see if any of you were listening to a certain degree. If you want to pop in the chat, what are the symptoms of diabetes? So Helen, yep, first.
Brilliant. Excellent. So we've got thirst, we've
Fatigue,
got
blurred vision,
fatigue. Yeah, blurred vision.
increased
Yeah.
urinary thirst, well, that's, yeah. We've had some people been listening, that's good. Yeah. So the
Want me to move on,
four,
Luce?
yeah. So the main ones you've kind of covered. So you've got your thirst, your thinner, toilet, and tired. So the thinner one, that's more related to the type 1 diabetes, and then it's a rapid weight loss without trying. Your main for your type 2 are your thirst, you're going to the toilet all the time and just feeling tired. For patients that people that have got sort of learning disabilities, potentially it could just be that they're not they're not interested in normal things that they're wanting to do, that they like to do regularly. They just feel a bit and not really kind of interacting as they normally do as well. And yeah, so you just remembering your thinner is more to do with the type 1. Obviously your body's not using the sugar in your cells to in your blood to get the energy, so the body has to break down muscle and things quite rapidly to get that to get that energy, which is where that thinner rapid weight loss comes from.
And also, it's like it's the other thing just to say is that with a type 2, you'd have to be really, really unwell and quite far on to be sort of rapidly to be losing weight. So it tends to be, and that quick presentation, that's the difference between type 1. The quick presentation, you find, the symptoms develop really quickly. Yeah, we're going to come on to that, Shirley. Shirley's put a really good comment in that we didn't have any symptoms. Absolutely, Shirley, we're coming on to that. And some people don't. Yeah.
It could just be so these are the 4 main ones, but it could be other signs. If you move on, Claire.
Sorry.
So it could be quite subtle signs. So if someone's got skin infections, delayed healing, just constantly not healing, repeated thrush infections, urine infections quite regularly, blurred vision, someone mentioned in the chat as well. Fatigue and feeling drained, so you have a really good night's sleep, but you're still waking up really tired. With the urine infection and thrush infections, obviously your body's trying to get rid of the sugar, and to do that you tend to urinate it out. So obviously the environment isn't great. So that's where the urine infections and repeated thrush infections are coming from. So it's just not, your body's just not able to kind of deal with the amount of sugar. Skin infections, obviously, blurred vision. Your little capillaries don't like being in such a high sugar environment, especially with the eyes. So that's where the damage kind of comes from. And some people, it's the first sign that there's something strange going on. They go to the opticians, they look at the back of the eye and they see some potential damage there. So people have been known to be diagnosed just from having blurred vision. Next slide.
And really interestingly, because Shirley's putting about not having any symptoms, and it is so interesting because actually you'll have somebody with a really high blood sugar who's tottered along with no symptoms, and you'll have somebody else, and different people present differently. So that's why we screen. So the high-risk patients should be screened by doing a blood test, because we do know that some people without symptoms will go under the radar. So it's brilliant you brought that up, Shirley. Absolutely.
Yeah.
Sorry, that was
again. So the biggest thing, yes, people might not have, but if you know someone or yourself have any of those symptoms, raise the alarm. Obviously, if someone has severe symptoms, that really rapid onset, potentially type 1, it's go to A&E, seek immediate medical attention. Again, it is a medical emergency. Going into diabetic ketoacidosis is life-threatening. Mild symptoms, seek advice of a GP. If you think yourself, as I say, GPs are very busy, your practice nurses are very busy, you're going, you've got another urine infection or thrush, again, it is quite easy for them to kind of just give you the medication to treat that, but not think actually this could be the third or fourth in a couple of months. So know yourself, know your own body. If you've got any symptoms that you're unsure, say to them, can I have a HbA1c? Could it be diabetes or pre-diabetes? Maybe starting. But if you're in any doubt about anything, don't be frightened to advocate for yourself, for your family members, if you're looking after someone. Diabetes can be prevented, it can be put into remission, and getting it earlier reduces the amount of complications that you can potentially have. So yeah, get assistance if you need it.
Really interestingly, Luce, there's some questions coming in about pre-diabetes, which we're coming on to. So
Yeah.
somebody sharing that they had pre-diabetes for many years, and then after starting chemotherapy, the stress on the body, the chemotherapy tipped it into type 2 diabetes, and it looks like a couple of people that's happened to. So it's really interesting because that's what we're coming on to next. So thank you for your comments.
Yeah. There's nothing to do with koalas, it's just it was a cute picture, and Claire thought it would be something a bit different. Although koalas can get diabetes, and they are treated with insulin and use continuous glucose monitoring, so they get the insulin levels right. Just a bit random for you. And we like the picture of the koala bear. As we've got a few people that have already said about pre-diabetes, we've kind of started talking about it, so we may as well move on. So pre-diabetes, what is it to start off with? So on the left hand side here, HbA1c, which is the blood test that we can have. It looks at sort of the blood glucose control over the last 3 months. Glucose sticks to the red blood cells, and they do a fancy pants calculation to figure out what your blood sugar's kind of been averaging over the 3 months. Anything below 41 and below is absolutely fine. You're plodding along nicely, thank you very much. Anything above 48 is you're a diabetic. You need to be kind of looking at treatments. The pre-diabetes is this section here, so there's 42 to 47, so you're just in the middle. Your body's kind of not quite working as it should be. So don't panic.
I
You're
think
not
Lewis,
diabetic
can
yet.
I just come in? Sorry, to just
Oh,
come in.
go on.
Just to bear in mind that actually, if you are, because there's some people in the group that are type 2 diabetic. So if you're type 2 diabetic, you'll always be type 2 diabetic. You might be diabetic in remission. However, you can have these, you could have bloods if you've got good control in these ranges. So you can have them in the lower ranges. Where when we talk about a pre-diabetes diagnosis, this is somebody that's like a new person, never had a diabetes diagnosis. So you're looking at if you've got a HbA1c blood test of 42 to 47, that would be a pre-diabetes diagnosis. If you're looking at a 41 and under, like Lucy says, absolutely normal. But if you're looking at 48 and over, it wouldn't be diagnosis of diabetes type 2 generally, unless you'd got symptoms or a second diagnosis. So that's just a little bit more information on that. Sorry, Lucy, you carry
No
on.
worries. Yeah. As you can tell, we are a bit of a tag team. I mean, Claire, we worked together for 3 years, and a lot of the time it was just us. So we're just thing. So yeah, so don't panic. You can prevent the full type 2 diabetes developing at this point. So the things that we can do is move more. Exercise is really good at regulating blood sugar, especially after eating meals. Losing weight, obviously weight gain is a significant risk factor. So, losing weight, moving more, and reducing sugary and complex carbs. We will look at sort of diet shortly. So just your general lifestyle things. You can put it that you don't get the type 2 diabetes. So I've got a couple of things, just make sure I'm not missing anything in the chat.
Yeah, so we're going to come on to talk about the pre-diabetes that Caroline's popped in.
Right.
We'll talk about the READ programme in Sheffield and South Yorkshire. If we want, can we request a blood test via our GP to check our blood sugars levels, even if we don't have symptoms or aren't high risk? That will very much depend on your GP. If you've got concerns and worries, a GP might do a one-off test as a reassuring factor for you. If you will come to basically some evidence that you can go to the GP with to say that I am high risk, and that will guarantee that you will get a test. It really does depend on your GP. Most GPs will be sympathetic for somebody that's got concerns and worries, and they would rather do a blood test to reassure somebody than somebody spend a lot of time worrying about it. And then I used to run a diabetes support group in Huddersfield. They are few and far between. Actually, in Sheffield, they're not. They're quite a common thing, so we'll come on to that. Yes, Shirley. So it's confusing. Some people with diabetes often say they are cured. Yeah, absolutely. You're just reassuring what we said earlier, Shirley. That's absolutely brilliant. You can, lose weight, come off all your medications and be classed as diabetes in remission, but you should always get screening. You should always keep that diagnosis. So absolutely bang on. So that's what we're saying with those blood tests. You can have excellent control as a type 2 diabetic, and that's what we tend to say when you're reaching those lower blood tests. And my blood sugars were high for years. I've refused insulin, but Trulicity has been, oh, that's so good to hear. Yeah, absolutely. Some wonderful stories with the weight loss medications for diabetes. Absolutely, Helen. So the diabetes has got some amazing new novel medications coming through. And in the years that when I started, it was like literally there was 2 medications, and now there's just like this whole array, and things are really developing in diabetes care. So that's wonderful. So I think we've covered all questions and things loose in there.
Yeah.
Shall I carry on, Doc?
Thank you for putting all them in. That is brilliant. So pre-diabetes, we can see it as an opportunity. This is your chance to catch everything early, maybe do some things differently, to not go fully into type 2. So yeah, trying to get diabetes diagnosed early, and potentially prevention is the way forward.
And I do think a pre-diabetes diagnosis can sometimes be a wake-up call for somebody. People plod on through life, and then they can get a pre-diabetes diagnosis, and they think, actually, I can turn back. I can go over that cliff and develop type 2 diabetes, or I can make some lifestyle changes and not go on to develop type 2 diabetes. So I think screening for pre-diabetes, which I know we've talked about in the chat with people, is an amazing thing. And actually, if you are high risk, getting screened is a really, really valuable thing to do. Back to koala.
Yeah. So what can we do to prevent type 2 diabetes? I have mentioned it slightly. If we
Did you guys want to tap something in chat? See if you've got any ideas. See if you're still awake in there.
I know it's lunchtime, so I do apologise.
Yeah, I'm keeping you on your toes, you see, just so I can manage to move slide on to the next slide, really. So, so if anybody's got any ideas, what could you do to try and prevent type 2 diabetes? Somebody's already put in about, attending the diabetes prevention session somewhere. So that's already in there. Is there anything we can do with lifestyle? They've all gone to sleep, Luz.
I think, yeah. Eating well and moving more, yeah. Exercise, eating healthy, maintaining healthy weight, diet, yep. So
should we have a little quick look?
Yeah.
Because it's not rocket science.
Eating well as normal, eating well, moving more, but know your risk and get screened. So we will be putting in a link to there is a know your risk website section that we can that will pop in the chat in a bit, so you can check your own risk for it, and things like that. So Nabila's put she's got a desk job, so I've incorporated walking 5 minutes on walking pad to move more. Absolutely, every hour that it is. Yeah, I need to have my watch on that beeps to tell me to get up and move. It even told me that after doing 18,000 steps on my holiday one day, it told me to get up and move because I'd been sat down for far too long. So yes, that is a fabulous way to get increased movement into your day, Nabila. Well done. So
we'll start off with people have put down lots and lots of things. These plates are compliments of Sheffield Teaching Hospital, and I know there's a dietitian on here, so I don't really start talking about this, but these are from Carla from STH, and she's kindly let them use them as part of our presentation. And this is really looking at diet for somebody wanting to prevent type 2 diabetes, or even somebody that has type 2 diabetes. This plate isn't suitable for somebody that's frail and elderly and at risk of being underweight. So it is like a diabetes type 2 prevention kind of plate. And if you've got diabetes. And the main thing is at this plate is that there's 50% shed loads of vegetables in diet. So there's a massive big area of your plate that's vegetables. And then what that means is that you have less areas to put the other things that might be more increase your risk of developing diabetes. So having too many carbs in your diet increases your risk of having diabetes. Having too much fat in your diet because you've put weight on and laid weight around the middle increases your risk of developing type 2 diabetes. So if we have less space on our plate for these because we're having shed loads more veg, that's brilliant. So look, a good source of protein is really, really important because it fills you up, and often protein has very little carb in it. And then you've got a small amount of carbs, a maximum of like a quarter of your plate. You do need some carbohydrates for energy, but it's just a smaller amount than used to be on the plates that we used to see for people. So reducing your carbohydrates, because if you eat lots of carbohydrates, they will really basically break down into sugars, and then they'll increase your blood sugar levels and increase stress on your pancreas. So the other thing just to say is that when you eat a lot of veg, it slows down the absorption of the carbohydrates. So we met somebody the other day that was diabetic that told me that they were going to have a bowl of chips for the tea. So there's nothing wrong with having a few chips with a meal, but maybe if they'd have had that with something like a piece of chicken and some salad and a few chips, that would have absorbed a lot slower, that portion of carbohydrate, and they would have been fuller for longer. So just be aware of that. and Shirley's come in to say, yes, there are absolutely. We have a Carla does different plates for different ethnicities. So there are some plates available from STH that do focus on different ethnicities. I'll try and get Caroline the details of that if anybody's interested of which ethnicities Carla's got the plates for. So Carla Dan Francisco is the dietitian at STH who's done lots of work around different cultures and their carb intakes.
Caroline's just put in as well about her dad being a bread lover and regularly eats bread throughout the day, tried to educate that spiking his blood sugar. The one thing you can get him to do, Caroline, is put the bread in the freezer. It changes the makeup of the carbohydrate, so it actually absorbed slightly differently and it doesn't spike blood sugars as much. So anybody can do that. If you put your bread in the freezer, it say alters the makeup slightly, doing that. So that might be a way if he's adamant that he's going to eat an entire bread loaf a day type thing. But yeah, pop your bread in the freezer, people, and it'll help.
And I think that's it. Little things can make a big difference. So if he likes his bread and he's only going to have sandwiches, whacking a bit of salad in, whacking a bit of protein in will slow down the absorption of the carb. Putting in freezer will make a difference. It's small, but all these little things. The other thing is, really importantly, is exercising after you've eaten. Me and Lucy are going to put this slide up and we'll have talked about everything before we've even finished it. But the things that you can do, it can be small, can seem quite insignificant. So if your dad is going to a bit of a bread lover, he eats too much bread, actually and you're not going to change that, because I don't know if he's like my dad, he won't change for love nor money. So, but actually after a meal, if he went for a walk, that would help regulate his blood sugars. And we see people that use the Libra devices that people wear, the continuous glucose monitoring. You often see people with like white discs on their arms, and you can see they have been brilliant for educating people about the benefits of exercise after you've eaten. Because if you do, have a big meal or you're having cake or whatever, and you think, well, actually, I've gone and eaten too much. Sometimes people think, oh, well, I can't do nothing about it, but actually, you can get out and have a walk, and it'll make a difference. So we've got some top tips because I know we're running short on time. So the top tips are just common sense things about adding sugar to food, trying to go for, sugar-free options rather than, if you do have sugar in tea and coffee, trying to reduce that down and stop having it in there, educate your palate. Be aware that crisps, biscuits, cakes, things like that will be loaded with sugars. Lewis has already said about freezing your bread. If you cook chill or you cook freeze, it will alter the way that the carbohydrate is. The dietitian online will probably be able to tell you a much more swankier way of saying these words, but basically they'll slow down the way that the carbohydrate is absorbed. So if you cook a meal like a load of pasta and you pop it in the fridge, it will the carbohydrate will be absorbed slower than if you didn't do that. So batch cooking and freezing is brilliant because it makes you eat better anyway. And when you're stressed and short on time, it makes you eat better. And also the cooked chill help with the absorption, the speed of absorption of the carbohydrate. Drinking shed loads of water before a meal, because actually sometimes we can be thirsty and we can think it's hunger. Again, shed loads of veg. If you can eat veg with a meal, it'll slow down your absorption. We've covered that. Oh, we haven't done this one, Luce. Small plate. So just checking your eye. If you know that you're having big portions, lower it down. Somebody on here was saying that they were on a weight loss drug called Trulicity. And actually, what often we say with drugs like Trulicity is you will reduce your portion. And actually, if you can start to do that with a perception where you're reducing your portion anyway, that can help. Tricking your eye is so important. Nowadays, when you go out to a restaurant, they have these massive big plates, big meat plates for a dinner. And actually, should we not go back to having a proper small tea plate with our tea on, as opposed to these massive big fancy dishes? I cannot stress the benefits of walking after you have exercised, after you've eaten. Just cannot. It is just wonderful. So if you exercise, 10 minutes after you've eaten. Don't sit down and vegetate after you've just eaten. It will have a massive impact on your blood sugars and your general health. And then my big hate is smoothies. If one more person tells me that smoothies are really healthy, I might have some sort of like meltdown. So all smoothies are doing is they are digesting your fruit in advance in big amounts, and then when you take it in, your sugars are hitting your bloodstream really fast. When we treat somebody with low blood sugar, we often treat them with something like a fresh orange juice. So that shows what juices and smoothies, how quickly the sugar's absorbed. If you're going to have fruit and you're at risk of diabetes, have whole fruit, have the fruit with the peel on, and have it as a whole piece of fruit. And if you're at risk of diabetes, just a couple of portions a day is adequate, with a load, as many veggies you can get in your diet. Now we're going to quickly just cover. Lux, did you want to do this about your risk? Because I'm aware I've been chatting away. Do you want to do the risk one?
Can do, yeah. So I mentioned earlier that there is ways of knowing your risk. So I have popped the link in the chat to this. There's online risk checker. Again, caveats with everything. Be mindful. It's not like you will get diabetes, type 2 diabetes. Everybody is different. But it gives you an indication of potentially you might be at increased risk. So you will need a tape measure and some weighing scales. So unfortunately, you will need to know how much you weigh and how big your waist circumference is. So height, weight, waist circumference, gender, ethnicity, family history of diabetes, and blood pressure history. Obviously, all of them amalgamating to give you a diabetes risk score. That can be used as a guide of whether you want to kind of look into more of your lifestyle advantages, or speak to your GP or healthcare practitioner about maybe getting a HbA1c if it's saying high risk, or if you've actually been thinking, I've been having a couple of the symptoms that we've mentioned. So do bob on, but again, don't panic. If it comes out that you are at a higher risk. As I say, everybody is different. It isn't a guarantee.
And then I've popped this in the chat, Luz, because obviously the benefit
Yeah.
of exercise is massive,
Yeah.
and we're encouraging people to walk after a meal, but actually doing regular exercise is really important as well. So I've popped that in the chat.
Yep.
And then, do you want to just run through this? Or do you want me to do it?
Yeah, so the diabetes prevention program. So this is if you've got in that the pre-diabetes level, you haven't been diagnosed with diabetes before. You can be referred to it. Someone said that they've been referred and not got back to things, so we can look into that for you. It aims to prevent or delay the onset of type 2 diabetes. So it's kind of supporting them lifestyle advice and looking at kind of your own behavior change and increasing that physical activity, and just kind of getting a bit more awareness of eating more healthily and understanding yourself a little bit more. It is 9-month course, face-to-face or digitally. It's generally like once a month. There's maybe a little bit more intense couple right at the beginning, but then it's once a month over the 9 months. Hopefully, the effect of that would be a weight reduction and being able to, as I say, reduce that HbA1c, so you're not going into that type 2 diabetes. Somebody that's had gestational diabetes, whether that's 10, 20, whatever, however long ago, they can be referred as well. And if you've got someone that's gestational diabetes right now, they can be referred and contacted after being given birth. Over the age of 18, obviously not currently pregnant, and can't have developed diabetes fully is the eligibility. Obviously wouldn't potentially be useful for everybody. So, individuals may find other things useful.
And then we're just coming on to the last slide now because I know we're tight on time. So I think the take-home messages that me and Lucy thought were really important is think about your risk factors. So if you've got risk factors, are there any that are specific to women? A history of GDM, PMOs, but also, like think about your risk factors anyway, your ethnicity. Do the risk score. It takes you 2 minutes. It'll work out whether you're high risk. Ask for a HbA1c test to screen if you are high risk. Ask for an HbA1c test to screen for diabetes if you're concerned that you've got a strong family history, that you've got symptoms. Think about the possibility of type 2 at a young age. Be aware that this is becoming a disease of our younger population, and be really mindful of those symptoms. Thirst, toilet, tired and thinner. And you can, Lucy's stressed this, you can prevent type 2 diabetes even if you've developed pre-diabetes. So that's the end of our presentation with those take-home messages. Have you got anything else to add, Luce?
There's just a couple of questions that had bobbed into the chat. So Melissa's put, don't they say if you exercise after eating, it slows down your digestion?
I mean, if you have got I would say that definitely exercise after eating, because what we want is we want the blood sugars to drop quickly after. So I would absolutely say yes. I know what she's saying, because what they say is, oh, actually you need your blood supply to go to digest the food, but actually what we want is we want to slow down that absorption of sugar, don't we? So what we want is the activity to allow the blood sugars to drop. We're not, maybe in somebody elderly that you wanted to gain weight, you would say that, but definitely not in somebody that were diabetic, at risk of diabetes, pre-diabetes. Please exercise after a meal. And it also makes you feel better, makes you feel less sluggish. It's a, really good, positive mental health aspect as well. So does that answer that one?
Is honey better than sugar?
Well, I think we've got a dietitian on board here, but I was always told sugar's sugar. So yes, honey will put your blood sugars up, sugar will put your sugars up. And there may be some research that says that, there's certain type of honey may have benefits, and honey in dressings has benefits, but honey will put your blood sugars up. And I worked with a lovely lady that used to just say, it's basically your middle class sugar. So just so it will put your sugar up, and it tastes lovely, and I can't deny it. In a nice honey and lemon drink it does taste lovely, but it will put your blood sugars up. So I apologize about that. And they should be avoided. Because what we want to do is preserve our pancreas. We want to preserve that pancreas. So no matter what type of sugar we put in, we're then overworking our pancreas when we don't need to. So we should avoid sugary foods if we can, and not have as many sugary foods in our diet, including honey. Have we got any other questions?
I think that's everything. I've tried to keep up with it. We do hope that you've enjoyed that you've got a couple of things out of it.